Passion is the name of the game. That's what we're going to begin with, and hopefully we have it throughout the entire evening. And thinking about passion, I'd say this is a good way to end a day, thinking and talking about loving and throwing in a little sex on the side. You're here because you want to make a difference in your love life. If you want to get into the spirit more, I think you can move a little bit closer together with your loved one and hold hands. It's perfectly okay. Barbara and I came to the subject of sexuality and impotence because my own erection plumbing wasn't working too well, or should I say not at all, after prostate cancer treatment. And it's a big blow when that happens. You get to ask yourself some really tough questions. Am I still a man? I see some nods of the heads here. What does it mean to be a man? Will my wife still love me the way she did before? With Barbara's help, I did a lot of soul searching. Together we figured out one major thing. I was not my erection. That was not what defined me as a man. We also decided that no matter what, we were going to have a sexual relationship. We were going to find a way to express our love with our bodies.
So we went on a quest to find information, but it was a little bit of a frustrating experience because there was not much for the layperson out there. And honestly, most doctors don't really prepare the patient and the partner for what's going to happen afterwards. My good luck, Ralph's education is as a zoologist, and he's also done a lot of work in the medical field. So he understood much of the terminology that was out there in the literature that was written for doctors, and he was able to translate it for lay people like me. And as we were working on this issue of erectile dysfunction together, we found that the old way of thinking about loving didn't really work for us anymore. We had to get out of our rut, and we had to change things, get creative, and that meant being willing to explore new things, try different things together, new approaches to lovemaking. Now, our first instinct when we lose something as important as the erection, our natural tendency is we want the erection back, because then we think everything's back to normal and we can have good sex again. But what worked for us was to turn around that question. Not how can we get the erection back, but how can we have good sex with or without an erection? And we found that we had a very pleasant surprise in store for us. When we were young, we didn't know what could befall us some later year.
Blood pressure problems, sexual dysfunction, cancer, you name it, oh dear.
Que sera, sera, whatever would be is here. The future is now, my dear. Que sera, sera. How we will deal with our fate, that is a choice we make of our own. Take every challenge, meet it head on, or grouse, complain, and groan. If we make the choice of working with what we've got, we'll be pleasantly surprised. We can do quite a lot. With or without the medications, with or without the machinations, we can have great sex, orgasms, pleasure, and show our love beyond measure. That is what can be. And if you don't believe me, just try it and you will see how great loving can be. we'd like to share with you some of the things we've learned in our research and in our personal journey. How to get erections back, and more importantly, how to have great sex with or without erections. And the message we'd like to give you today is this. Most men who've had prostate cancer have experienced impotence, but a loving couple can still have the sexual intimacy they want. You can make love with the way you are today, with or without aids and medications. Both men and women can have sexual pleasure and orgasms without medications and without penetration. And the key to having great, satisfying, sensual sex is to work together, to become creative, and to be willing to share and explore new things together. You see us here together as a couple, because only as a couple can we handle erectile dysfunction successfully. In a relationship, good loving is the physical expression of emotional intimacy. And that means sex is connected to love. Ralph, can you hit the button twice, please? Yes. Good loving is a delicious thing. So we compare it to a pie. What are the ingredients of good loving? A pie generally consists of the crust, the filling, and the toppings. The crust is the relationship, the basis for everything else. If the crust isn't good, the rest of the pie won't hold together, and it won't taste great. How good the loving is depends on the quality of the relationship. Then there are the fillings of the loving pie, the things you need to do. Communicate, get reacquainted, think love, not sex. We'll talk about that, all of these. And then there are the toppings, the aids and medications to get erections. Now, pharmaceutical companies are trying to tell us that all that matters are the toppings. But we know better, because toppings without the rest of the pie are not very satisfying. The good news is that you can have your pie and eat it too with erectile dysfunction. But before we talk about all these parts of the loving pie, let's touch on some basic facts about impotence and sex.
The first fact, impotence is common and has many different causes. At least 70% of all prostate cancer survivors have impotence problems for some time or permanently. Keep in mind that at least 31% of all men did not have normal potency before treatment. And we'll go into that a little bit more. Let's compare the effect of potency, on potency of surgery, radiation, and hormone therapy. With surgery, there's a sudden decline in potency with the possibility of recovery over time. With radiation, the decline is sort of gradual, and at about 4 years, about the same percentage of men have impotence difficulties as did as the men who had surgery. In recent conferences, now, are you the one that had laparoscopics?
Yep.
Yeah, okay. And with laparoscopic, now did they go all the way to robotic surgery? Or was it strictly laparoscopic? The surgeon did it?
The surgeon,
Okay,
surgeons.
okay. So, but with laparoscopic, with robotic surgery and various forms of radiation, the doctors say, well, they have a better rate of success in preserving some potency. And I don't know where you are on that. We'll go into that. But all of the doctors say you have to be potent before treatment. Otherwise, it's not going to bring it back. Hormonal treatment and the removal of testicles depress libido, but they do not prevent orgasms. Removal of the testicles has the same effect as hormone treatment. One is a surgical form of castration, whereas the other is a chemical form. So the issue is, can a man get aroused when his libido is low? Dr. Stephen Strum cites a study that showed that 25% of the men who were watching who were watching the movie, had their testicles removed, but they had erections after watching an erotic movie. So can castrated men be aroused? Really, the question is how?
And we've had a lot of conversations with hormone treatment patients about this, and I just want to tell you one story. A man shared that his partner and he had always enjoyed getting dressed up for each other, and she continued to do that. Even though he was not very interested, he certainly didn't initiate. But he was finding that he became receptive when she was trying to turn him on. And so she would, get dressed up or do something else that he used to like, and he would be able to react, to respond to her. But she got to learn that he wouldn't initiate, but he could react. But it helped him. And he said, my partner was creative and aggressive. So, she kept pursuing it, and they were still able to have a sex life. We also know about some other cases where the depression of the libido was so strong that really nothing happened, but also some of that may have had to do with the partner not having as great potentially a level of interest. But you definitely see a variation, but this was an example of a story where somebody had no desire by himself, but he was able to be turned on and to actually achieve orgasm, even though he was on pretty strong hormone treatments.
I'd like to insert another note here, and that is the reason why men on hormone treatment or surgically castrated men can have, in many cases, erections and certainly orgasms, is because the nervous system has already experienced having sex, having orgasms, deriving pleasure. Okay? In the old days where they had eunuchs watching the harems, the reason why the eunuchs were safe is because they were young boys when they were taken and castrated, so their neural system never experienced the pleasures of orgasms and erections. Okay? So the point is, it's like a memory bank. You've got a chip in your neural system that keeps track of your sex. So that's good. You have to only give it pleasure, and it'll keep logging it in. Okay. In addition to cancer treatment, there are other causes that contribute to the loss of sexual function. Some of the top causes that interfere with erections are lifestyle choices, such as smoking, alcohol. And by the way, alcohol is a sedative. It decreases sexual interest. It's not like the college guys say, I'm going to get her plied with some liquor and then she'll be ready to go. She'll be ready to go to bed. That's it, not for sex.
Sleep.
Yeah, for sleep, that's right. Street drugs, certainly, and then diet. High-fat diets, the fat and the high-fat diets, block arteries. And if they block arteries to the heart, they also block the arteries to the penis. You can't get blood flowing to the heart, you won't get it flowing to the penis. Okay? So a guideline for great sex is a sensible diet and a lifestyle that includes physical and mental exercise. Then, of course, there are the other causes that are not voluntary, outside of cancer treatment, that also affect sexuality. Surgery or radiation, TURPs, 3 to 40% of men who, the TURP means transurethral resection procedure for people who have difficulty with urination, could cause anywhere from 3% to 40% impotence. Physical injury, certainly some diseases such as Parkinson's, multiple sclerosis, depression, many medications cause it. And then there's the effect of aging. Circulation is just not as good. You need more time to get an erection. You need more direct stimulation. Erections are less firm. Takes a longer time to get to orgasm. And your partner has to work with you. Orgasms are less intense, and recovery time is longer. This was illustrated when a young 70-year-old asked an 85-year-old, "How is sex for you?" And the 85-year-old answered, "It takes her a little bit longer to get me ready." The second fact, impotence is stressful. Let me tell you, as a man, I know it's ever up here, okay? When will it come up? If it will come up, will I be able to do something tonight or then or whenever? Okay. Carl Simonton, Dr. Carl Simonton, who's done a lot of work with patients and couples on how to deal with cancer, says that sexual readjustment rates as at 39 on the stress scale. This compares to being close to that of getting fired, and you know how stressful that can be. And it is more than half the stress of going through a divorce. So it ranks pretty high. So anyone who's willing to poo-poo it and say, well, being impotent, what's the big deal? There's a lot to deal with here. Okay, fact number 3.
Orgasms do not require prostates or erections. And erections do not equal orgasms and do not cause orgasms. An impotent man can make love and have an orgasm without an erection and without intercourse. But he can't make love and have an orgasm without being aroused. So you always have to be aroused. Why is it? Because the nerves that cause an orgasm use a different pathway than the nerves that cause an erection. But everything is always dependent on arousal. And because of the male and female anatomy, men without prostates can have orgasms and dry ejaculations. And even orchiectomy patients who've had their testicles removed can have orgasms. And men and women can have the same pleasure, sensation, and release other than the penetration. And men who have no erection at all can give their partner pleasure and an orgasm. And we'll talk more about how that is being done.
Okay. Fact number 4, about recovering potency after treatment. How long does it take? You've been through it for any number, some for months and some for years. Okay. In the past, doctors used to say, well, we'll know about your potency in about 6 months.
After surgery.
After surgery. Okay. And when I went to my doctor after 6 months, with the limp little guy in hand, he says, well, he's not ready yet. We have to give him, the true story, we have to give him another 6 months. So I went back at the end of a year, well, he's not going to do it on his own, we got to start you on shots. And that was the first time I had a Caverject shot. That's another story. Barbara can tell you better the story.
This is the man who was very used to giving shots because he was a medic at one time. And I saw him turn white as a sheet when that little needle came close.
Okay. Well, anyway, you're not going to find out in 6 months or a year. What happens is that the nerves regrow. We'll talk more about the nerves in a few moments. But regrow at a very slow rate, a millimeter a week. When nerves are cut out, they ain't going to get very far in 6 months. So let me tell you. So the point is, doctors are now accepting to tell their patients it can take up to 2 years. And by the way, the current thinking is 3 and 4 years. And some of the patients I've counseled have said, you know, I'm starting to experience some of the feelings back in the testicles, in the pelvic area, and so forth. Want to ask a question?
Yeah, when you say the nerves grow slowly, does that mean the nerves that are responsible for getting erections, they can, in essence, regenerate if they've been damaged during the surgery or even...
Okay. Let me defer that for next slide, okay, later, in a little bit, because what I am saying is that if there, that ties into another issue. Let me cover that later. And so, now, one of the things you can do to help restore the neural connection, and it's important to do this in order to keep the penis viable and vital. Otherwise, the penis is a muscle. It can die if it doesn't get the right nutrients. Okay, so you got to keep the blood flowing. So in this period following treatment, and even though the doctor said, well, if you don't do it in the first month or 2, it's too late, you must daily massage the penis. You must get blood flowing into the penis, and they call this a penile massage. and later on we'll talk about penile rehabilitation. Okay? And this is based, as I just mentioned, on the concept of nourishing the penile tissues immediately after whatever treatment you've had, where even if you're on hormones, you've had radiation, or you've had surgery. So if after surgery, if you've recently been treated and are impotent after surgery, you may recover some degree. We can't talk, but we don't know what the degree is because it depends upon the surgical procedure. On radiation, daily massage, and sex. Sex is extremely important, you know, and we're going to emphasize you must have sex. Okay? May minimize the long-term effects of radiation. IMRT, or intensity modulated radiation therapy, and some newer techniques may minimize the damage according to doctors who performed the procedure. The jury is still out. We don't have enough of a track record because some of the robotic surgery has just been going on for about 2 years, and we don't know what the viability of or the recovery of the potency is on a patient. As far as hormone therapy is concerned, again, we're back to daily massage and sex may also minimize the long-term effects. Because if you're not experiencing the libido, you're not going to get in the evening what young men get, and is a little bit sparser as men get older, is what we call nocturnal erections. Erections at night which are based on no stimulus other than it's nature's way of getting blood flowing into the penis to make sure that all the nutrients are getting there. Okay? And the major danger of all treatments is the lack of use, which can cause atrophy of the penis. And it's really a situation of use it or lose it. Let's talk about potency after nerve sparing. The study of men 2 years ago showed that 56% of men who had bilateral we said that where they spared the nerves on both sides, and 59% of the men who had unilateral or sparing the nerves on one side were still impotent after 18 months. Okay? So even with bilateral nerve sparing surgery, patients are not as potent as they had been previously, and I don't care what the claims have been. I talk to the patients, and notwithstanding, doctors do their best, but the end result is what's the effect on the patient. And patients have less potency than they had going on in. Sometimes it's higher, sometimes it may be close to being as high, but usually it's much lower. But the reason for that is the nerves for an erection are not one thick cable. Let me show you here. So here we have
what color are the nerves, Ralph?
The nerves are yellow. The blood vessels are blue for the veins, red for the arteries, okay? That's to correspond to what they think the color of the blood is inside you. So here you see the nerves, and they're going up alongside the prostate and into the prostate, what they call the prostate bed in the pelvic area. You're going to take out and this is the bladder, and here's the prostate. When you take that out, you're going to cut all the nerves, no matter how careful they are. It's not like one thick telephone cable, but imagine the telephone cable when it's cut open, and you see all these little wires in it. That's what this is like. Okay?
In fact, there's probably a lot more little branches than is indicated on this schematic.
And by the way, this is Dr. Pat Walsh's slide from Johns Hopkins. And this is what he deals with. So he tries to spare the nerves, but you see as the nerves come in here and over to the bladder, and they're ending up cutting into the urethra and so forth, you find that you've got the problem because he will cut it. So even if you retain the main wires, a lot of the little ones are cut. And therefore, the neural system is not complete, which means less of an erection and less sensitivity. One patient I talked to said at the end of 3.5 years, he finally got more sensitivity back on the scrotum, which he had completely lost, but he had prior to surgery, and he got some of that back. So it does take a lot of time. But so the good news is that although the nerves take a long time to grow back, They do. And as I mentioned, they grow back at the rate of about a millimeter a week. And the natural desire and proclivity is to grow back just like a mole burrowing through your backyard grass. They find alternative ways of getting to where they used to be, but they want to grow back, but they may not make it. And you need the penile rehabilitation with daily massage. Age plays a role. The younger you are, the better your chance of recovering potency. Neural grafting regeneration. And to the newly diagnosed man back there, the point is, if you ever have to go into this, if you want to get neural grafting, and neural grafting is where they take a nerve, they started with taking a nerve out of the ankle and transplanting it into the pelvic area, and not that they can connect because the nerves are fine. They can't sew them together. They lay the nerve in there, and it's like a scaffold. And the nerves grow along that bridge to meet each other. 2 or 3 years, maybe 4, depending upon how much they've had to cut out. Okay. Now, the newer grafting procedure takes an inguinal nerve in the lower part of the pelvic area and transplants it. But again, it takes a long time, and to date, only about 25% of the men, or the studies have shown, only about 25% of the men who've had this procedure have had any degree of success. Okay, fact number 5, the thing we never want to talk about. But exercise is the key to recovering potency and maintaining it. You really have to be in decent physical shape to make great love. Sex is physical activity. Okay? And by the way, that's the reason that the Viagra, Levitra, and all of these, they talk about, you have to be heart healthy and so on in order to make love. Because sex is really a physical activity. It's a combination weight and aerobic workout. Maybe if I can put it this way, neglecting exercise and talking about recovering potency is like putting up wallpaper with one hand tied behind your back. You can't do it, okay? And it's important to remember that not only will exercise will help you improve your lovemaking ability, but you'll feel better about it. Look at the bonus. Exercise has the additional benefits of helping to retard the recurrence of cancer, wards off diabetes, and reduces heart disease. And of course, it controls your weight. It can control your weight, so you can fit into your college clothes or your military uniform. Studies show that with significant weight gain, men have less endurance, poor lung capacity, and high blood pressure. High blood pressure is usually treated with medications, and we know that many blood pressure medications reduce desire and potency. So it's a vicious cycle. You gain weight, you get heavy, the waist expands, blood pressure goes up, improves the prospects for diabetes and heart disease, and at the same time, you can't make decent love. It's a no-win proposition here. The runner's high has been a driving force for joggers and others who go in for strenuous exercise. The endorphins they generate make them feel good. But exercise makes you feel good even if the knees, the joint, and the back prevents one from getting on the jogging trail and exercise less strenuously. In fact, it's been proven that very unfit people get a good response from even a little exercise. One impressive study that tracked 50,000 men over 15 years found that while exercise did not make a difference in their chance or your chance of getting prostate cancer, it had a dramatic effect on your risk of dying from the disease. Men over 65 had a 70% lower risk of dying from the disease if they exercise at least 30 minutes a day. That's not a heck of a lot. Okay. Studies have shown that vigorous exercise increases sexual satisfaction for both men and women because the exercise pumps blood to the erogenous zones, in other words, the sex zones, the areas you feel better when somebody touches it. The libido also gets a lift because you can improve your confidence in your appearance and have a better sense of well-being. So how much do you need to exercise? Studies have shown that men who burned at least 200 calories a day from exercise are less likely to become impotent. You know what that is? That's a 2-mile walk every day. So what you are physically can impact your love life. Exercise, I think, is mandatory for a good love life. And you can think of it as sexercise. And one easy way to get into it, if you want, you've heard about these things called pedometers. They track how many steps you go. And there was a study that showed that the Amish men walk at least 10,000 steps a day. That's not hard to do, by the way. You don't realize it. And by the way, women are much more likely to do it because they're running around doing housework and doing all kinds of things. But in fact, by the way, I have a pedometer here. And I've gone 4,907 steps today. That's including several miles in the morning that we did together.
Yeah, but it excludes the swim. That makes up for some.
Yeah. And then the swim makes up for the rest of it. So the point is, it's not hard to do, and you sort of get into the swing of it. And when you put this on, you'll find that between 2,000 and 2,500 steps will give you a mile. So effectively, I've done my 2 miles here, plus the equivalent of a couple of miles maybe or less, or the energy I burned was equivalent to that while we went swimming. So that's a way to ease into the thing. Okay, let me talk about another kind of exercise to help you get the blood flowing into the pelvic area, and that's called Kegel exercises. And they not only get blood into the area, but they improve muscle control. Doctors tell women this after they've had kids or they have any problems, and women have often been told about the Kegel exercises.
And it's good for potency and for bladder control also.
Right. So there's several ways of doing it correctly. I'm sorry, one way of doing it correctly, several ways of not doing it correctly. The correct way of doing it is the man should tighten down as if he's controlling the flow of urine, stopping it completely. Hold it for a count of 10. Then while you're holding that, at the same time, contract your rectal or urinal muscles for a combined count of 10. Okay? Relax, and do it again. Now, you can do it as many times a day as you want. Nobody need ever know that you're doing it. And if you're in a conference and you're bored out of your skull, you can concentrate on doing your Kegels, and nobody is ever going to know the difference. You know, they may wonder why you have a smile on your face, but so be it. That's their problem. Okay? Let's talk about your pie, how to have your pie and eat it too, starting with the crust of the pie, the quality of the relationships. After some years together, marriages get stuck in a rut, R-U-T. Archbishop Theodore McCarrick of the Washington, D.C. Diocese said a couple of years ago that most marriages get stale over time. So you have to find a way to keep it alive, to keep it going. The relationship becomes routine, unappreciated, and tired. Get out of the way here. Partners get to the point where they don't appreciate each other. And there's an underlying tiredness that pervades all areas of the marriage. Areas in a marriage, you can't separate one from the other. You know, I'm going to have sex with you, I can't get along with you on the other side. It ain't going to work. Okay? So difficulties in one part will affect all the other parts. So how does a couple get to what we call a crest relationship, where the relationship consists of creativity, thinking of new things, respect for each other, having it be exciting, there's a sensitivity to each of the partners, and of course, a togetherness. A CREST relationship happens when the partners deal with the emotional, non-sexual part, as well as the physical, sexual side. I see a number of people nodding their heads. You know, we need to create an overall environment of love. There are many little things we can do with and for each other. The Boston therapist, Myra Kirschenbaum, she authored a new book called The Weekend Marriage, Love in a Time-Starved World. It talks about a clinical research study that showed that people who were successful were doing the little things consistently. The key is in concentrating on each other and having positive experiences in the way we do things, and we remember what we did when we were first in love. We recover the memories of the years which bound you together to begin with. Okay? So to do the little things consistently, what are they? Put your arms around each other. Touch. Kiss a lot. Take walks. And do things that you enjoy together, whether it's going to a movie, to a museum, go shopping, whatever it is. There are very small things that you have to do, but that begins to rebuild the togetherness part. And that's what happens, is that over time, marriages sort of split away. People go their different paths. And then how do you bring them together? It's like, you know, you need to put them in a vice maybe. Maybe it'll work, I'm not sure. Okay? These things may not be considered sexual, but they keep our physical, sensual connection.
Did you mention showering together and putting lotion on each other after?
No, you can tell that story.
Well, we're in the habit of putting lotion on each other, and I remember being at a friend's house, and they have a swimming pool, and we took a swim, and afterwards Ralph took a shower, and I said, oh, I got to go down, and I got to put cream on him. And she says, oh, I hate you for doing that. My husband's always wanting me to do that, and I don't want to do it. But it really helps us to stay physically connected. You know, it's not a sexual thing, as he said, but it's a way of showing each other, I love to touch you, and to stay physically connected. Now, let's talk about the filling, if you hit the button. First and most importantly, communications, talking with your partner. Experiencing erectile dysfunction is a crisis of identity for many men. And for the couple, a normal part of their relationship is disrupted. The man very often retreats. He may feel that he's no longer a man, or he's not sure of his identity. But one thing's for sure, he doesn't talk about it. Now, most women, unfortunately, choose not to say anything because they don't want to embarrass their partner. They assume he'll bring it up when he's ready. But he'll never be ready. So now the couple has something that they avoid talking about. But they can't avoid thinking about it, because it's like a little island that they have to go around in their conversations. They hear someone talk about love, they see a couple kissing, watch a movie, that subject is there again. And so many couples try to avoid anything that could bring up that subject. Many couples, unfortunately, stop touching and even talking intimately. And in time, they avoid more and more subjects that could lead to talking about sex, until there is this big, big conspiracy of silence, and it separates the couple. That's a tragedy. That can destroy a relationship. A woman in a support group described their sexual problems as the elephant in the room, and they just wouldn't talk about it. And finally, after the elephant kept getting bigger and bigger, she decided it had to be addressed, and she sat him down and they started talking, and that's how they got back on track. But you really have to make that effort, because otherwise there's a big danger of drifting apart. From the man's side, one of the most common problems is that the man feels it's my problem and I have to solve it myself. And an example is actually the leader of a support group who was a military man and very independent, and he felt this was his problem to solve. And his wife felt terribly rejected and hurt, and it didn't really sink in for him for a long time, and then one day he realized that his impotence had a profound effect not only on him but also on his wife. And once they started to talk, they were able to improve their love life, and he opened up to her, she opened up to him, and that made for a great improvement. But it was a very difficult time when they wouldn't talk about it. Now, many impotent men feel badly because they feel they can't please their wives. That's because they assume they know how they can please her, and it's one way. How many men have actually asked their wives how they can please her? They should be in for a pleasant surprise, because once you start asking the question, you find that there are many different ways that a woman can be turned on, and that erection and penetration is a very, very small part of the equation and is really not essential for a woman's sexual satisfaction. Now, after cancer, you have to deal with the results of two situations. One is there are certain patterns that have been established in the relationship about things you talk and don't talk about. And second is this big new subject of dealing with the effects of prostate cancer. Now, because of the cancer situation, you may have gone through a period where you haven't made love in quite a while. And the longer it has been, the more difficult it may be to get restarted. So some important things to discuss when you're interested in restarting is, are you both ready to start again? Are your loving styles in sync? Have they maybe changed? Do you want them to change? How do you feel about them? And if you're considering the use of medications and aids, are both of you in agreement that you should try them? What are your expectations? For example, many of the medications come in low, medium, and high dosages. Well, from one standpoint, doctors want to give the high dose, so there's a greater probability of producing an erection, and therefore the confidence level will build up. But there's another logic that says put the least amount of stress on your system, see if it works. If it doesn't work, then you go to that next higher strength. And if both partners have that understanding, that's something that can be worked out together. I have to tell you a story about a couple's differing expectations from a friend who had both an implant and an artificial sphincter. He told the surgeon to label them come and go so he could make the difference between the two. After he got his implant, he was so enthusiastic. He wanted to use this thing morning, noon, and night. Isn't technology wonderful? But his wife wasn't ready for that. So they had to work out how frequently they would make love with his newfound capability. And that issue of frequency is an issue in many relationships, not just in prostate cancer, but throughout life, really. Brings up also the question, what is a normal sex life? 2.3 times a week, maybe? Well, it turns out that even the Viagra forecasters had trouble defining what a normal sex life was. So they worked out the revenue for Pfizer based on two rather different scenarios. One was twice a month a man would take it, and the other one would take it twice a week. So there's really no definition of normal. Normal for you and your partner is whatever you decide gives you pleasure together. Both partners need to agree on how often they want to make love and how to make their sex life more satisfying. Now, we've talked about couples the whole time, but also there are sometimes single men whom this affects. And many of these men have had frustrating experiences. Very often it's because the woman was surprised. She had no idea, and, the man starts to make love to her, and then he can't come up. She thinks something is wrong. It's much better if the woman is prepared and she knows. And we'll give you an example. Somebody who wrote in on a chat site for prostate cancer patients. He had prostate cancer after a divorce. A relationship developed with a woman I liked very much. One evening she made it very clear that she wanted to sleep with me. I felt my stomach tying into knots. What would her reaction be to the penile shrinkage? Would I get an erection, and if so, could I hold it? I took the bull by its horns and explained my post-surgery complications. She smiled and shared her own fears of not having had sex for a couple of years. For obvious reasons, she thought that a dry orgasm sounded like a good idea. We went to bed, and sure enough, at the time of entry, my penis went limp. We laughed. I felt proud of myself for having shared my fears and my choice of a partner who showed understanding of my position. However, I had no problems bringing her to a number of climaxes. That was an awakening call to me. I did not need an erect and big penis to satisfy a woman. I also came to the realization how good and rewarding the sexual act could be without penetration or an orgasm. And he's not just talking about her. I know that my manly image was not impaired by not being able to maintain an erection. Another myth goes out the window. So there you have it from somebody whose name is not Alterowitz. Communicating about your sex life is incredibly important, especially after a dramatic change brought on by cancer treatment. And a few years ago, after one of our sessions, a wife called the coordinator. She said that after the session, she and her husband went home. They talked about their feelings and about sex for the first time in 2 years since his treatment. They talked, they cried, they laughed together, and then they made love for the first time in 2 years. But they did that because they started to talk. Otherwise, they couldn't have made it there again. Now, one way to get warmed up for talking is to share fond memories, including memories of your favorite lovings. It helps to go on an archaeological dig of your life because, let's face it, as we are in a long-term relationship, there's a lot of dirt that gets piled onto that initial romantic feeling. And you really have to dig down deep to get to where the essence of the relationship is. For our 20th anniversary, we created for our friends and family a musical review about our relationship. And as we wrote it, we remembered how very, very special this relationship is. And ever since that anniversary, or ever since writing that script for the party, we have really had a tremendously revived relationship. But why? Because we reminded ourselves how wonderful the relationship is, and we were able to build on that romance again. So, you know, we did it through a musical review. Other people do it by writing their experiences, writing a joint diary, or writing something for their kids. Now, to your kids, you don't want to say all the sexual stuff, but you know, you can emphasize other aspects of the relationship. But anything that'll help you as a couple remind yourself of why you are together and why it's important for you to stay together. Just be prepared. Even if two people share the exact same experience, they don't always remember it the same.
We started at 6
We started at 7.
and went till midnight.
We were asleep by 11.
Ah, yes, I remember it well. We started with a soft, slow dance.
We went quite quickly into romance.
Ah, yes, I remember it well.
You played me oh so well, like a violin.
But it took a long time to make you sing.
It warms my heart to know that you remember still the way you do.
Ah, yes, I remember it well. How often I think of that Friday
Monday.
night, of that most enjoyable tryst.
And right in the middle your boss called if he knew what parts of your body I kissed. While you talked with him on the phone, trying to suppress a delighted moan.
Ah, yes, I remember it well.
When you hung up, you just went wild.
I tried to be quite gentle that night.
Ah, yes, I remember it well.
All you were wearing was a little chain of gold.
You never took your socks off, truth be told. How strong you were, how fun and gay.
You simply took my breath away.
Ah, yes, I remember it well. That was a fictional occurrence. Now, once you've started talking, it gets easier to share what each of you likes and dislikes sexually, what turns you on, and what you'd rather stay away from. As your bodies change, which happens as we get older, So do some of the things we prefer. So it's always good to have these conversations. Loving is a lot more than intercourse. And good loving in a long-term relationship is all about good communications, telling each other and showing each other what you want and what you like. Now let's go to the other fillings of the loving pie. Getting reacquainted and having sensual sex, and then the toppings, the medications available and under development. Getting reacquainted, to revive our love life after sudden impotence hits, means you need to get to know each other all over again, to learn each other's likes and dislikes, sensitive points, really to understand each other sexually. We basically have to relearn loving together. And that means taking time to touch, to talk, and to learn about each other's bodies today. First, it's a good idea to relearn your own anatomy and to learn about each other's bodies. You need to know where the pleasure points are. Feel where you get the pleasure and tell your partner. Pleasurable touching between a man and a woman is always possible regardless of the effects of prostate cancer treatment. Now, prostate cancer treatment often changes sensitivity. So before treatment, many or most areas in the genital area were sensitive for arousal for a man. And during surgery or radiation, because of some of the nerves being affected, all of a sudden, some of the spots that used to be wonderful and very sensitive no longer are giving much of a response. The woman has no way of knowing that unless the man tells her. On the other hand, there are some other spots, new spots, that were previously also sensitive but maybe not as forefront of his mind, which now all of a sudden he's more aware of and he feels more pleasure from. Again, he needs to tell her about the changes so that he can get as much pleasure and she can touch him in all the right places. So finding the points on the bodies that give each of you the greatest pleasure is a great idea. And don't restrict yourself to just the genital area. Remember that good sex is a whole body experience. Have a touch session. One touch the other all over, and then you switch. Part of your anatomy lesson could be a game called Find the Clit. The clitoris is the organ that causes a woman's orgasm. And it's important to know where it is and how it behaves. So just make sure you know those things. And also discover how many ways there are of stimulating a clitoris. Finger, a tongue, a vibrator, an erect penis, yes. And by the way, also a completely flaccid penis can be a wonderful stimulator for the clitoris. Similarly, you can explore what is most arousing to the man and try different things. Oral sex, vibrators, shared masturbation, erotic videos, erotic literature, whatever is comfortable in your relationship. Some people won't do certain things. Some people want to try all kinds of things. It has to be comfortable for both of you. But I remember one couple sitting in one of the prostate cancer groups, and they looked very conservative. And she said, well, you just kiss it until it gets well. And I thought that was a very profound and loving statement. And I remember another group where a woman said, I never imagined, as a good Catholic girl, all the things I would do just to show my husband how much I love him. But in both cases, it's love that drives these different behaviors that maybe people weren't as comfortable with earlier. Now, part of getting reacquainted is also understanding each other's body chemistry and what makes a person sexually responsive. Very often men are more penetration-oriented and women are more loving and touching-oriented, and there's a biochemical reason for that called oxytocin. It's also been called the cuddle chemical. And it's the reason why most women need loving and touching in order to be sexually responsive. Women secrete oxytocin when they nurse their babies, and the basic reason it's there in Darwinian terms is that the mother bonds with the baby. But also women get a lot of oxytocin during sex, and during climax, oxytocin absolutely skyrockets. Now women have this much oxytocin and men have this much. So that explains why for women, sex begins long before penetration, and P.S. penetration isn't really that important to women, and it's not necessary for a woman to be sexually satisfied. which is great news when we are in an impotence situation, right? Now, let's talk a little bit about sex and getting older, which has gotten bad press, but the news is actually not all bad. There's an upside, and we should take advantage of it. Let me start with a story. A urologist told us about his 86-year-old dad coming to him after Viagra came out, and he said, "Can you prescribe Viagra for me, but don't tell your mother, and please put your partner's name on the prescription because she doesn't want you to know we're still having sex." Well, the urologist was delighted because if his father's having sex at 86, chances are he'll be having sex when he's that age, right? But the story points up a couple of things that were also supported by a recent AARP survey. Number one, it's perfectly normal to have an interest in sex throughout life. And number two, both men and women can remain sexually active their entire lives with or without erections. And sex for older couples has not only become respectable, but doctors realize that it's a very good and healthy thing, and it contributes to their health and well-being and the health of the relationship. Getting older also has another advantage, which is that men and women get more in sync with each other. As women experience hormonal shifts, their arousal speeds up. Remember the old days when he was done 1, 2, 3 and she would go 25, 26, 27, 28 and still not be done? Well, as we get older, he slows down and she speeds up. And we get more in sync with each other. What a wonderful gift of Mother Nature. So now we're at a point where both partners can reach arousal at roughly the same time, and then also, if there is a goal of orgasm, also possibly get to orgasm at around the same time. The key to good sex at any age is to accept the physiological and psychological changes that have happened and to work with them. For example, older men have reduced and delayed erections, so you need to take the time to enjoy the touching and other activities that we used to call foreplay. But maybe now it's the main event. And the result is that both partners can be more highly aroused. If we want to have good, satisfying, sensual sex with impotence, we just have to get out of some of the old habits and learn to make love in a new way. And that works best when we don't focus all of our actions just on intercourse. Which brings us to the next slice of the loving pie, the road to sensual sex. Think love, not sex.
This is the part I like the best. Talk about sensual sex.
Ralph, don't whisper, please.
Okay.
Can you hear him okay?
What was that?
Now we talk about sensual sex. Sensual sex begins with arousal. It's what you do to get warmed up for loving. And arousal consists really of two parts. The expectation, the anticipation of what you will see, of what you will do, what your partner will do, how you will feel, and how your partner will feel. You know, and it's an iterative cycle. One gets warm, gets the other one warm, gets it warm, and so on, okay? So it's like partner and being looked at. It's touching your partner and being touched. Kissing and so on. And then jumping at the bed, if that's your thing, okay? And getting aroused means getting into the mood and creating the environment for love, romance, excuse me, and seduction. Making love is an art. And you are, excuse me.
And you are the artist. Right?
Right. To be creative with your love life, tune into the things that are meaningful to both of you. And as Barbara mentioned before, it has to be what's comfortable between the two of you. When we talked about this in one support group, one woman piped up in the front row that she dreamt that just the night before that they would go dancing. Her husband agreed on the spot to go dancing that Saturday. Then another attendee stood up and said, "Hey, what kind of music do you like? I'll tell you where to go." And her husband agreed to go to that place. We hope this was the start of a new romantic life for them.
Do you want me to jump in while you're drinking? You calm your voice. Other ideas: writing love notes to invite your lover to a romantic tryst that day. Telephone for dinner.
Yeah, you're on the road. Hey, I just had a great idea. Let's go out for dinner tonight. Okay? One guy wrote a note, and when they went to dinner, the maitre d' brought this big tray with one of these big covers, like you'd cover a big turkey, to the table. And she asked, "What's this?" He says, "Open it." And inside was a little card that says, "What are you doing after dinner?" You know, the expectation, the anticipation. You can make a bet that the rest of their dinner was not just thinking about food. Dress up. Remember, he worships you, so dress the part. You worship him. You better dress the part. Okay? Use scents, or if candles, colognes for excitement. Be playful. Many couples find it helpful to watch erotic videos. Again, if that's your thing, do it. An 84-year-old woman at one of our sessions came up after the session, and she says, "I have to show you something." And she took out of this big bag, it's bigger than the pacing cancer bag out there. And she takes out of this bag something like about a dozen videos and about a dozen books, and said, "What do you think of these?" And we said, "Hey, as far as we're concerned," she says, "That's fine with us." She says she and her 87-year-old partner use these to get excited. And given that the major part of arousal is anticipation, anticipation is not high when it's the same thing time and time again. So change is the keystone to increased expectation and excitement. So change the situation. What does that mean? Well, one, change the place. You don't always have to make love in the bedroom. It could be the living room. It could be the study, a hotel room. One couple I knew loved to do it on the steps. Well, I mean, again, if that's your thing, on the steps is fine.
Must be large steps.
Yes, but it has excitement. Change the way and the places you touch. Try a new way to touch. Light touches, caresses. I mean, like a lot of men don't know that caressing the side of a woman's breast very softly, hardly even touching, because most women have, because women have their nerves, their nerve endings at the side of the breasts. Touch those for a few moments. She'll have experience she never did before. Okay? Change the time you make love. As we get older, our biological clock shifts backwards. Sleep metabolism changes with age, and so does our sex metabolism change. See, at one time you could go to sleep, you can go stay up late till about midnight, 2, 3 in the morning, sleep till noon. That doesn't work anymore. Now, you get up at 6 o'clock, whether you went to bed at 3 or at midnight. Okay? Well, you can't think about making love at 10, 11 o'clock when you should have been in bed 2 hours ago, because it's not going to be much fun for either one of you. So do it in the afternoon. Do it in the morning. Do it as a wake-up call. Start your exercise that way. Okay? Change the way you, pardon? Okay. Change the way you make love. Change your sexual style or your routine. Everybody's got a routine. First we do this, then we do this, then we do this. Okay? You don't want to do the same thing the same way, because then you don't get any expectation. You know? And there's a bunch of feelings and emotions that go along with it. So how do you begin? One way is simply by asking to make love. And how about doing it this way? I'm in the mood for love, just simply because you're near me. Funny, but when you're near me, I'm in the mood for love. And by the way, he doesn't have to sing it to her all the time. She can sing it to him as well. Her voice will probably sound better than mine did.
How come you've never sang that to me?
There's never been a need. You always come at me.
Yeah, right.
Make love. Do it whenever, wherever, however you can. It prevents the disconnect between partners And of course, as we mentioned before, inhibits the atrophy of the penis. Make love as often as you both like it. You can't do any damage. If something hurts, just stop that particular thing. Mira Kirschenbaum, the woman I talked about a moment ago, said, you absolutely have to schedule sessions where you have time to make love. But that doesn't lack spontaneity, you ask. But doesn't that lack spontaneity? She answers, it's what I call planned spontaneity. If you wait for things to happen spontaneously, you'll never make love. Making love doesn't have to have a deadline, so you keep putting it off. So what's wrong with scheduling it? That doesn't have to reduce the anticipation if you say, today we'll do it a little bit different. I talked a moment ago about dressing up, okay? And for example, we've got a friend that where every time, not every time, many times when he wants to make love, he wants to get aroused, tells his wife, why don't you wear that blue dress? The dress she wore on her wedding day. She can still fit into it, so that's good. But anyway, that turns him on like nothing. So anyway, go ahead.
Another aspect of relearning loving is that both partners need to get used to the idea of taking turns, pleasing each other. It's okay to ask your partner to do something for you, and then you reciprocate another time. Focus on giving each other sexual pleasure, touching, rubbing, kissing, massaging, stimulating the clitoris and the penis. Be sensual and try new things together. As part of relearning loving, you can also do some very low-cost, common-sense things that help in your sex life. Things we call home remedies. Ralph, the button please. A couple of common-sense things to do are the vagina and penis must be well lubricated. And that becomes especially important as women get older and the lining of the uterus is not of the uterus, the mucus, the vaginal area, oh gosh, I'm thinking about menopause, is getting drier. Many people are familiar with KY jelly, but the original version is quite sticky and messy, and there's a more natural feeling lubricant called Astroglide. But I have to tell you, we recently went to that section in the supermarket, and we found that KY jelly now has a lot of different products out, and there must have been 20 different products to choose from. So there's new developments there all the time. But these lubricants, find one that you really like and that feels natural, and then that's a great improvement. Another good thing to do is to use gravity. Making love in the missionary position or standing up for the man helps draw the blood into the penis rather than him lying flat on his back, which drains it out. So, little things can help maintain the erection. Also, many men can have some degree of an erection that enable a partial penetration. Even if you don't have an erection, there's some engorgement of the penis. And it's probably stuffable or mashable. And for most women, as we've discussed, pleasure is not a function of how deeply a man can penetrate. So these partial penetrations can be very pleasurable for both parties. Successful loving after prostate cancer definitely requires both partners to work together. And a woman plays a big role in rebuilding the man's confidence. For example, her reaction to the suggestion to make love, her support for starting with the lowest dosage of her medication, and also her reaction to leaks. And let's talk a minute about these incontinence issues. About 2/3 of men are experiencing some incontinence, varying levels, after surgery, since they lose one of their sphincters during surgery. And there are also radiation patients who sometimes have issues. It's quite, the milder versions of this incontinence are quite similar to stress incontinence, which many women experience. And honestly, women have leaks throughout their lives and they don't think it's such a big deal, but men get terribly uptight about it. If you just have a small case of incontinence, you don't have to let that get into the way of your love life at all. A little dose of humor and some tissues or a towel will help a lot. And there are also some other things you can do. First of all, if you have a tendency to leak, void completely before you start making love. And the best way to do that is to actually sit on the toilet. Just close the door, nobody will ever know. Secondly, a nasal decongestion is known to sometimes help stopping a tendency to leak. It helps women with mild stress incontinence and men as well. Cranberry, yes.
Using that on your nose or on your penis?
On your nose. On your nose, yes.
Are you talking about Sudafed?
Yes.
Yeah.
Sudafed or any one
Yeah.
of those.
Right. It's worth a try. You know, not everything works for everybody, but these are things that could.
Makes you drowsy.
Yes, thank you. That's right. Another thing is cranberries. For a long time, people were poo-pooing it, saying that's an old wives' tale, but now there are a lot of studies that show that cranberries have a very positive effect. And for a long time, Ralph put cranberries on his morning cereal. He tried to find the unsweetened kind to reduce some of the diabetes dangers, but there are also some juice products. Now, I'm not talking about the ocean spray stuff, which is 90% sugar and 9% water and 1% cranberry. Some of the natural food stores sell pure cranberry juice. Now, that is so tart that you've got to mix it with something else like orange juice or something, but it's worth a try to see if it helps some of the incontinence issues.
But by the way, just to interject, the cranberries has an effect that prevents, or at least for 90% of the cases, prevents irritation of the urethra. And if you've got irritation of the urethra, that's the pipe that comes out through the penis, you're going to urinate much more frequently. And it can also be that the infection or the inflammation will prevent the sphincter from closing much more completely. So you get a continual leakage. So my suggestion to you, and I was getting into that before, is cranberries or blueberries, by the way, that works as well. So take a good dose.
Blueberries.
Oh, blueberry.
Yeah, take a dose of that, and in your case, you can do it 2 or 3 times a day to see how that helps, because that may be part of the problem.
Now, speaking about home remedies, some herbals can be considered, but really only in consultation with your doctor. There's a lot of marketing hype about herbals. They are drugs, and you need to use them with extreme caution, and especially when they have names like Longitude, Vigorex, Erogenex, Maximus, or anything like that. That's really 99% marketing hype. Be very, very skeptical. There's a lot of unproven claims, a lot of hype, and we get 5 zillion spam messages a day that have all these promises. There are very few things that are really even thought to potentially be beneficial. So definitely talk to your doctor before you add anything to your collection of pills. Even if they're herbals, they are still medications, and since they're not regulated by the FDA, there's also some additional caution. Now let's move on to the toppings, the therapies and medications.
Okay, we talked about the toppings before, or at the beginning, saying you don't need them. You can use them as a treat. It can help the man get an erection or get some engorgement, and if that gives pleasure to both of you. But before you start, there are a number of things you have to know. Number one, that's after you come to agreement, right? You have to know how each of you will feel about using medications and aids. Some people don't like the artificiality. There are other side effects that we'll talk about. Because they do have side effects. They can affect the man's blood pressure. Viagra is well known for the headaches. All of them give some headaches. Viagra even more so. Some visual disturbances. Some of you may be familiar with some of the problems with Viagra insofar as the visual problems that have recently surfaced that the FDA is cautioning Viagra to put a disclaimer on the package. We'll talk more about that. They do not work on everyone. And Barbara mentioned the different dosages. It doesn't matter. They won't work. Now, on the other hand, they may work sometime. They may not work another time. They don't work equally well all of the time. Some of them work better over time. Let's say I've seen one report come through that after about trying it 15 months, this one man was able to get a response with it. So keep in mind that all of the medications are based, the data they put out are based on clinical trials. And a clinical trial is a selected group of men who are most compatible with the nature of the product, and they will give optimal results. When you put it out into the general marketplace and general population, you're going to find all kinds of diversity. You're going to find all kinds of side effects you may not have experienced, the company may not have experienced before, and so on. So you've got to keep that in mind. Okay. But medications and AIDS fit in two ways. The first is to keep the penis viable and vital. In other words, have the nutrients flowing and keep the penis tissues alive. The second is that really it is an option for getting an erection. So one is sort of as a therapy for having a healthy penis, and the other is for using it in sex. Now, sexiness, there's no other way to say it, it's all mental. It begins here, then it goes someplace else. Except for prostate cancer patients, it may not go there. But many of the commercial products, though, require the man to be aroused. And it won't be seen in terms of an erection, but it can be seen in terms of the way the man feels about it. So, therapies and medications are based on the fact that the most important sexual organ is between the ears. And if your partner doesn't give you some stimulus, and you don't give your partner stimulus, it ain't going to happen. Okay, so what's right for you is a decision made jointly by you, your partner, and your doctor. Currently, here's what's available. The orals, and I'll talk more about each one of these. Okay. And see, can we get to the next slide? Mm-hmm. Before you use any medication, you should know, and it's a lot to know about because most of the time we're oriented, doctor gives us a prescription, we take a medication, and we just do what the doctor says. For me, before I take a medication after the doctor has prescribed it, I look it up. Luckily, we've got an internet. What are the side effects? Because you don't know before you get the package, and then there's that little tiny flimsy insert with microscopic language on it, and in words and terminology that you don't understand, okay? So look it up on the internet, or get somebody to do it for you, or call the company and ask them to send you the material. Who makes it? What's the brand name? What's the active chemical in it? How much should you take of it?
And how often?
And how often? And the administration. How do you take it? Do you take it in a shot? Do you take it with water? Do you take it with food? Take it after food? Take it before food? Hey, there are all these kinds of things. Okay, the status. Is it available? The FDA, the process, clinical. This you don't have to get into because it's usually available if it's been prescribed. Insofar as the medication, or I won't even call it medications, the profusion of products that are out there. Barbara mentioned some of them that say this will help you get an erection, and there are also the Viagra, the Levitra knockoffs, and so on. Hey, know if it's been FDA approved before you buy it. How much is it? What are the side effects? And the comments is what happened in the clinical trials, and then if you have a problem, where do you go? And the best source for what happens with a side effect, it better be the manufacturer. The doctor may not know all of it. He'll have to explore it as well, but you should know in advance.
By the way, the reason why this says medication write-up is because in the book for each of these, each of the medications, we have all of these listed with the status of last year.
The oral medications, most of you know, okay. You can't take any of these if you're on nitrate medication, alpha blockers for hypertension. They do reduce the blood pressure. And some people take their blood pressure medication in the morning, some take it at night. If you take it at night, it's a double hit, and your blood pressure can drop. And I've had it where my blood pressure, my total blood pressure has dropped to 80/50. That's getting marginal. Okay? So what do? If you know you're going to take it, you can talk to your doctor. You must talk to your doctor. I'm not giving you any medical advice because I'm not a doctor. But you could talk to your doctor about skipping a day of the hypertension medication. How many people here are on hypertension medication? Okay. Everybody almost. Okay? So talk to your doctor. Do you skip it? And now, if you can't skip it, try and put as much separation between the two medications as much as possible, and ask the doctor whether the dosage should be adjusted of either the hypertension medication or the oral medication here. Viagra comes in 3 strengths, so there's Levitra and Cialis. The Viagra, there have been a number of problems with, and if you have retinitis pigmentosa, one of the retinal illnesses, I'll call it, or any other retinal disease for that matter, it can cause blindness. And in recent months, there have been 40 cases reported of blindness over the years. Pfizer says, no, that's not true, but their FDA is going to force them to put a warning on their package. This is just new over the last few months. So my concern would be, if you've got any visual problems, there are 2 alternatives, okay? And by the way, the reason for this is that they inhibit a certain other photodiesterase. Levitra, Cialis has been called the 36-hour one. Supposedly, it works at least for 17 hours. It's good, or they call it the weekender and so on. But all 3 have the same side effects: headache, flushing, and the big thing is that these 2 don't have a food restriction. So Viagra used to have the food restriction. You should take it 2 hours after having a meal, ideally a low-fat meal, then wait another hour, and then you can have sex. As one man said to us in one of the support group meetings, so for the next hour I can read the newspaper, then I'm ready to go. Okay? No. As I mentioned before, you must be aroused. So that says some period of foreplay, some period of doing something that gets both of you excited. Otherwise, you've wasted $9 or $10 for the pill for that night. Okay? Yohimbine used to be is an herbal, but it's not an innocuous herbal. It does have significant side effects. Sometimes some studies have said it works. Sometimes studies have said it doesn't. Now they're pairing Yohimbine with an intraurethral, which I'll talk about in a moment, a different medication, and there's a clinical study on it. There's nothing clear. The people who are making this now are making another Afil. I forget what they're going to call it. They call it, I think, Avafil, and it's going to be another one of the orals, and that may be out about 2 or 3 years. The first set of clinical studies have been shown to be positive. Okay, so now, since you have to wait so long to take Viagra, if you're going to take it, somebody suggested that why wait till you eat? Take it before you eat, and then why wait till after you eat to have sex? You might as well have sex as the appetizer, then go on to dinner. Okay, don't take it more than once a day. You can't take more than the max dosage. Now, doctors are using Viagra, Levitra, and Cialis as a way of stimulating the blood flow into the penis in order to keep the penis viable. That gets pretty expensive at $9 or $10 a pill. Oh, by the way, I should also mention here, a common practice is to buy the 100 milligram pills and cut them in half. Caveat on that. We don't know that the medication is distributed equally within throughout the pill. So if you cut it in half, you're getting the half that has the 100 milligram in one case and nothing on the other side. Number 2, the Viagra pills have something like what they call an enteric or a sugar coating on it in order to make sure that it gets dissolved in the blood, in the stomach at a certain point in the digestive process. Once you break it, now you've got a portion that just shows the active chemical and the other ingredients. So you don't know where that's going to get absorbed into the bloodstream, and it may not have the desired effect. Next. Okay, intraurethral. This is a medication. By intraurethral, you insert it into the penis, into the little orifice at the end of the penis. It comes in a long syringe that's about 2 to 3 inches long, has a little tiny pellet inside of it. I see people now. Anybody use Muse? You've used Muse? Okay.
Tried it.
You tried it?
Didn't work.
It didn't work. Okay. There have been a lot of dissatisfaction. what Muse did, what the Vivus people did, is because Muse did not work on many people in the general population, they then came out with a thing called Actus. It's a constriction band that you put at the base of the penis to retain the erection. And this is pretty much then, it works more so like a penile pump, which we'll talk about in a minute. But what happens with the band is, because there's no blood flow, the penis gradually gets cold, cools down, it's not body temperature, and you must release the band in less than 30 minutes. Otherwise, you can get gangrene of the penis, and we know what happens with gangrene, so I won't go into that horrible idea.
And also having an ice-cold penis in the woman is not very much fun.
Okay, penile injection. They're the most effective. This is the best known. It used to be made by Pharmacy Upjohn. It's now Pfizer. And then there are these others, and I'll go into this in a minute. Okay, they are the most effective. However, two downsides, two side effects to watch out for. One is plaque. Over a period of time, because there's internal bleeding, you get little deposits which get hard. And if obviously deposit gets hard in the blood vessels, they restrict blood flow, and you're not going to get an erection. The other thing, and they end up creating some difficulties. And by the way, that brings up a point. If you're going to use an anybody here use any injections? Nobody. Okay. But they are the most effective. And as much as I went white, as Barb says, when I had my first one, it became a trivial issue. You know, you feel a tiny pinprick for a second, if that at all, and it works very well. It has to be administered in the right way, at the 10 and the 2 o'clock positions. That's number one. Number two, at the point of insertion of the needle, apply pressure for at least 3, ideally 5 minutes. And the pressure is not because of possibility surface bleeding. That's what many doctors don't tell you, because they're not aware of this. You're not going to get very much surface bleeding because you're not going to puncture blood vessels, usually going into the penis. What it is, there's internal bleeding. And that's what causes the plaque. So to apply the pressure is to stop the bleeding, if there is going to be any, internal into the penis. Okay? So they work well, but you've got to watch out for both the plaque, and the other thing is the possibility of what they call priapism. P-R-A-P-I-S-M. For those who don't know, that means an extended erection. Now the manufacturers say 4 hours. I'm conservative. I say 2. If you're going to have an erection that goes on beyond 2 hours, take an antihistamine like Sudafed. There's one that my doctor prescribed a long time ago called Breathin, B-R-E-A-T-H-I-N, and immediately take that. That will bring down the erection. If that doesn't bring it down, get yourself to an emergency room. Because to my way of thinking, if you get to 3 or 4 hours, you're in serious, serious trouble. And it can cause death as well. I mean, I don't want to scare anybody, but you know, you have to know what the possible side effects are and take the adequate precautions.
Did you talk about the side effect of the scarring, Ralph?
Yeah, the plaques.
Okay, sorry.
The plaques, the
Okay,
scarring.
yes.
Yeah,
Okay,
yeah.
that's-
I should say that Barb talks scarring. Plaques and scarring are the same thing. They talk about really obstructions in the flow of blood within the penis.
And that, of course, in the long term will make impotence worse.
Yeah. Now, ED specialists and some urologists will do this. Depending upon if your own situation, if some of the other things don't work, you want an injection, and one, that's the way we'll call it, custom tailored to you. There's what they call bi-mix, trimix, and quad mix. And the reason for that is there's 2 here, there's 3 here, and there's 4 here. Okay. This is the most effective. It will what?
Ingredients?
Yeah.
2, 3, and 4 what?
Ingredients.
Okay.
The pifavirin and phentolamine, this plus this in terms of the trimix, and plus forskolin. With the forskolin, quad mix works best. will help you retain an erection about 80% longer, and also will be responsible for much more rigid erections. Okay, go back, please. Okay, the other thing is that a lot of people have problems with the trimix only because the prostaglandin E1 seems to cause them some penile pain. And so, but that's not true for everybody. It is true for some people. Okay, there's a penile splint sold in the over-the-counter market in drugstores, and for that the man needs to have some sort of an erection, and it's a little plastic sheath that goes over the penis to give it rigidity. On that, one puts an enclosed condom-like sheath in order to maintain the plastic sheath on the penis. The manufacturer says the woman should help guide it in. The woman, I must say, must be well lubricated because this can hurt her. Okay? But it comes with a sheath. Now, vacuum therapy devices, they're now called, used to be called vacuum pumps or vacuum erection devices or VEDs. Okay, there's a number of companies that make them. They're generally of two levels. One is the over-the-counter, for which insurance usually does not pay for. You get a prescription from your doctor, and the insurance will pay for. The prescription device is usually in the range of $395 to $500. The over-the-counter device is in the range of about $200. Some of them are more like, and people find them uncomfortable, and some of the partners will use it, some don't like to use it because there's something like a jack handle on it, and it's like you're jacking up a car at the same time instead of you're jacking up your penis, you know. But the one thing I do want to make, the point I want to make here, that they do help you get an erection. You do need a constriction band in order to maintain the erection. The biggest problem with maintaining erections for men who can get a decent blood flow is the fact that there's a venous outflow. The blood flows out very fast because the veins don't function as well, closing it down because the penis is not as elastic. The way it works in order to retain an erection is that as the penis swells up, the swollen penis or the engorged penis will press down on the veins so that the veins will shut down. When the penis is not as elastic and pliable, that won't happen. So that's one reason you want to keep the penis pliable with blood flowing in. And the other point I wanted to made the point that doctors are prescribing the pills, and some of them are prescribing these for maintaining, doing what they call penile rehabilitation. That is, as soon as you get about a month after surgery, you get either the doctor will put you on the pills or injections or a pump. A pump, while the outlay is larger at the outset, over a long term is much less costly. You know, if you're taking a pill once a day at $9 or let's say $10 a day, over a month you're spending $300. You buy a pump in a month and a half, it's cost recovery. It's an economic basis. We're looking at it business-like, right? But anyway, you should do something to massage the penis, okay?
May I ask
yes, please.
a couple comments and a question?
Yes, please.
Comments. My experience is with the TIM, and it's specifically with the TIM because I was told that Medicare would cover it. I had to get the approval first, but then Medicare covered it.
Okay. Oh, good point.
It took some practice, like maybe 8 or 10 times before being able to use it effectively. And my question is using this not always for making love, but in terms of massaging the penis, I have hoped, and at this point it's just hope, that this will be the kind of stimulation that will do some good. Any comment on that?
When you say kind of stimulation, what do you mean by stimulation?
You talked about massaging the penis.
Yes. That will, okay.
He shares your hope.
Okay, is that it is good for massaging the penis and bringing the blood flow. Do you find that you get engorgement when you're using this?
Yes.
Okay, Then you're bringing blood into the penis. Blood is flowing in, flowing out, and bringing the nutrients in with it. Perfect. We should do this. And let's see, I don't recall, when were you treated?
19 months,
19 months.
laparoscopic.
Okay, keep using it. Keep using it, okay? I think you're doing the right thing. It will take time, but it keeps it pliable, elastic, so that it will work better over time,
Thank you.
okay? And by the way, I found that I did that when I was done, had the surgery in '95, I didn't know about any of this. I've only started using the pump last year, and even then I find some increment of benefit from it, okay? Any other questions?
No, that was my question.
Any other questions, by the way, as long as we stop for a second? Okay. By the way, there is one device, it's not on here, is a device which is not with a handle. It is strictly a round tube, something like this, inserting the penis, and there's just a slide to pump up the penis. Okay? So I should mention that.
I think somebody sent us that brochure.
Okay.
Fairly new.
Yeah, it's fairly new. It's a South African device, and for me, and by the way, I have no vested interest in any product I've talked about. I get nothing. I have no relationship with them other than they provided information on request for the book, and that is, the cleanest design is this product. Okay, and if you want, we could talk more about that afterwards. Any other questions, comments? Okay. Penile implants. There's several. These have pretty much been discarded. They're semi-rigid, malleable for cosmetic reasons. They're easy to use. It's a simple surgical procedure. However, you know, it's the way they used to advertise it. When you're ready, you bring it up. When you're not finished, you put it down. And a lot of people aren't comfortable with that. There's 2 and 3 component inflatable. You need manual dexterity. I keep seeing stories where it's hard to get it pumped up. I'm having difficulty. I have to get, and again, it's the same kind of thing as with pumps. You have to get used to using it. Now, key point on the implants. It will not bring blood flow into the head of the penis. The head of the penis will still stay soft for the most part, unless you have a natural blood flow into it, okay? It will give you some degree of rigidity in the penis. I've seen some other reports recently that say, well, it's not as rigid as I thought it would be. They've got a high level of satisfaction. A lot of people like them. They're very reliable. Today they've come up to about 98, 99%. It is a surgical procedure. There is a possibility of infection, but again, minute. So I don't want to scare anybody off it. And a lot of people go to that as a last resort. And I would encourage anybody considering even an implant, look at it as a last resort. It can give you the erection. And the question is whether you can get the same satisfaction as you can without an implant. And here is a malleable implant. And you see here's the button. You squeeze it here. The pump is up here in the abdomen and inflates the penis.
And you also see why the tip of the penis doesn't get hard, because it doesn't go that far.
Okay, penile vascular surgery. Let me just dismiss this chart. It's for young people, problems due to accidents and so forth. It is not for older men and rarely will do any good. Recently I saw a new technique for venous ligation that's tying off the veins, more of the venous outflow, so you can retain the erection, and that does. It's only worked in about 50–60% of the cases. Okay, there are topicals. There are topicals being used in Asia. This company makes it. It's supposed to be introduced maybe in the next year or two here. This, I'm not sure where they stand. Palatin is a nasal device. Like you take a nasal decongestant, take a little sniff, and you're ready to go. We don't know about that. Okay, go ahead.
I asked the doctor, is that good for women as well as it is men? And he said, I never heard of the whole thing, so I don't know what it's like.
Okay. Penile rehab, start within 3 months. I suggest even a month. You can start with your doctor's concurrence. And I've got here the pump. We've covered enough of this. We've talked about this.
Now, if we want to summarize some of these things, it's a very personal decision whether you do anything about these medications. And, you know, for us, the conclusion after I picked up Ralph from the bathroom floor with extremely low blood pressure one time, and we figured that the shots were giving him that scarring, and surgery was not something we wanted to consider, and some of these devices felt like medieval torture instruments. We concluded that our favorite thing was to have natural sex without any of the aids and medications, even though sometimes we cheat. But, you know, a couple of times a month maybe we use the medications. But that, again, is a very personal decision. And we know people who are very happy with implants. We know others who swear by some of the pills. It's whatever you feel comfortable with, and also what works, because for some people the pills don't work or they can't take them for some reason, for example. But there are many different paths to a happy love life after prostate cancer. It's not just one prescribed way. Now let's just summarize some key points. Number one, impotence does not prevent us from having a good love life. You don't need intercourse to have pleasure and an orgasm.
If you want, use treatments and medications, even as a special treat just once in a while, but just have realistic expectations. They may not work.
Relearn to make love, have sensual sex for the sheer pleasure of being together.
And remember that sex is actually an 11-letter word. Communicate.
Now, there are more details in our book. If you're interested, as Paula mentioned, we brought some books along and we sell them for $15 a piece. And before we go on to questions, and we'll stick around also for a while, we would like to invite you to sing along with us the reprise of Que Sera.
Okay. Come on, let's go.
With or without the medications, with or without the machinations, we can have great sex, orgasms, pleasure, and show our love beyond measure. That is what can be, and if you don't believe me, just try it and you will see how great loving can be.
By the way, you know, if any of you want to, after this, want to write or call us, you know, if you go to our website, www.renewintimacy.org, or write to either me or Barb, Ralph at renewintimacy.org or Barbara at renewintimacy.org. We'll answer your questions or call you if you wish. Either way, whatever we can do to help.
And there, the article has their email address, and if it's in your little pile of stuff here. Just, and I don't want to stop questions, but I thought of two things I needed to remind you. If you would like to be on our mailing list, to be sure that you're reminded when our next topic comes up, and any other things that we do quarterly mailings, but we will mail for every one of these. Make sure you fill one of these out and just leave it out there. And please don't forget to do your evaluations and also leave them out there. So that's it. I have no more.